Our next speaker is going to come in and put everything together that we have discussed. So it's putting it together, the key takeaways and action points or plans from today's training. So this is Dr. Biyi. Dr. Biyi is an oncologist and the head of Department, Radiation and Clinical Oncology at the University of Port Harcourt Teaching Hospital. He also consults at the ASI Ukpo Cancer Center, Calabar, Nigeria, the only functional external beam radiotherapy center in the Niger Delta of Nigeria. He is a fellow of the West African College of Surgeons. Dr. Biyi is passionate about achieving the best clinical practice through appropriate sequencing of systematic therapy, including chemotherapy, targeted therapy, hormonal therapy, and radiation therapy to suit the individual patients. He recently served as head of the publicity committee for the 2023 conference of the Association of Radiation and Clinical Oncologists in Nigeria. So, Dr. Biyi, I'll ask you to come on the stage and make sure you keep your presentation as short as possible because we are behind time. Thank you.
Hello, everybody, and thank you for having me. I want to thank the speakers. I mean, all of the speakers, they have been absolutely fabulous. My job is a very simple one, and because of the constraint of time, I'm not going to go over the all of the presentations. I think they've been very, very dynamite. I need to start by saying that we have learned a lot today, and I'm hoping that if you've been a part of this from the beginning or at whatever point it was that you joined, you've come to see how extremely important that communication is. I mean, clearly from all of what we have heard, communication is actually both a skill and a tool that we need to develop. Because it's a skill, you can actually work on getting better at it, and indeed you should work on getting better at it. And I think it's also very important to understand that our patients will for a long time remember how they were attended to by us while they were at our various clinics doing whatever, whether we were seeing them as a clinical oncologist or helping them navigate through the cancer care continuum in whatever capacity. It's interesting how much, even in the present day in Africa, we still have such a huge problem with communicating with our patients. I know that we really need to, it's clear from these presentations, listening to all of the patients who spoke about some dreadful circumstances that they found themselves in with fear and anxiety being built on by careless communication. It shows that this symposium is one that the time was just perfectly right. And I would like to thank both Ukpo and, of course, Pink Africa, Dr. Anne in COE, for putting this together. So what are our key take-home points? Communication is an integral part when you're dealing with patients who have cancer. You have to understand that these patients are going through so much. There are times in your clinic where to make a pronouncement of cancer is just so difficult. And I mean, once you say it, I've had dramatic experiences as a clinician myself. I think it's very important for us to understand that minding our language is pretty important. Understanding that when you're talking with a patient who has cancer, you have to engage with them with empathy as against sympathy. I mean, putting yourself in their shoes and trying to see what they're going through so that you can best address their needs. And also, we need to know it's not a one-time thing and it's not a one-size-fits-all thing. Sometimes patients will need repeated counseling, and this can be exasperating, particularly when you think you may have done an excellently good job in the first instance or in the second instance, and then yet the third instance is coming up. Also, we need to be careful not project our personal beliefs onto what the patient, onto the patient. We're clinicians. Our job is to discuss the science in a language that they can understand, to take time to break things down for them. Personal beliefs are something we're going to need to keep aside, or personal expectations regarding the care of our patients. And over and above everything else, keep developing yourself, evaluate yourself, see how it is that you're doing. And I think that most of our centers should actually now begin to inculcate effective communication training on a very regular basis so that people can constantly improve on the skills to communicate. There are several models that are available online as resources that you can adopt as your institution, but then ensure that the training is ongoing and constantly being revamped, being re-educated, like a continuing education thing where people truly improve on their skills and then can communicate with the right kind of empathy, understanding that you can't sit in your consulting room detached, typing on your phone, distracted by people walking in and out. Those are things that really, really, really irk the patients and make them feel anxious. I'm sure that I hope I've done a good job putting up some of these key points. And in the interest of time, I'd just really like to thank everyone for the opportunity to be here to listen to this extremely, extremely insightful teachings by very, very stellar and capable faculty. Thank you so much.
Thank you, Dr. B. I don't think anybody would have done your job better than you. A very good, very perfect summary. Good to see you. By the way, Dr. B is one of my favorite persons in this profession. In case you want to tell the whole world that they will know. One of my favorite people in this profession. Good to see you. Thank you so much. That was a perfect summary. And there's a lot of work to be done. And I'm sure we have a lot to take away from this session.